proud that I'm part of a really high functioning team here at PeaceHealth. We're building a community of a really diverse group of nurses, and we all bring something really great to the team. We all have amazing strengths.
Rachel Kelley is really just an inspiring caregiver, and she possesses this quiet humility and this quiet strength, and she's just a caregiver who has an incredible sense of compassion and truly seeks to help others.
Rachel is both a formal and informal leader on our unit, and she takes great passion in mentoring not only new grads, but nurses that are new to acute care.
I have been called the mom many times by different people of the unit. I think it's because that I want the nurses to grow and to be independent.
When Shuckson Healthcare Center reached out to St. Joseph Medical Center for help in a time of extreme need, Rachel was the first person to volunteer, and because of her initial willingness to volunteer, she inspired several of her working colleagues to join her and pursue this very essential and critical support to a community healthcare provider in crisis.
The patients were all testing positive and the caregivers were getting ill. And we were within about 48 hours of potentially having to bring all of the Shuckson patients to the hospital. And we recognized quickly we needed to think outside the box. And so we put together a plan to ask for volunteers. And we weren't sure when we did that if we would get volunteers, because it was such a scary and unknown time to put your own self at risk.
4 people out of 10 from my unit went, and that's 40%. I thought that was pretty amazing. The fact that they felt it was the right thing to do to go and help was empowering, to say the least, that so many people stepped up.
All of our caregivers that volunteered to go recognized they would be 6 weeks without their friends and family. They would have to be in a quarantine status.
I signed up for a 4-week stint, and I was there for 4 weeks. And then I stayed away from my family for 2 weeks for quarantine. I didn't want to expose them. That was my biggest fear, was that I would expose them. I was gonna leave 2 days early, but my husband said, no, we need that extra day. And I think it was to clean the house.
I'm so grateful for Rachel. She really serves as inspiration for me, and I know for many others, to take the risk, to do the right thing at the right time. Rachel is really a living example of PeaceHealth's mission and values in action.